When we look at epilepsy, we have to remember that key part of the definition that means that it's more than one seizure, at least two are co-occurring at a time. So there is still going to be a range because even though it's no less than two, there can be far greater than two seizures occurring in succession. So depending on the level of epilepsy, if they have mild epilepsy, I know several people with that disorder, they do not have significant language difficulties. But then there are those with moderate to severe, which understandably, the more time that their brain is having these electric storms, as they call it, that can cause damage, lack of oxygen, all kinds of things, and there can be significant deficits in language. We particularly see the deficits in social communication and some difficulties in using correct grammar. All right, so now we're going to get to the part where we're going to kind of talk about, so we know about these disorders and their language development or differences. What does this mean for intervention? The first, or I should say the next video, is looking at an example of a young girl receiving some speech language therapy. She has cerebral palsy. This would be considered a kind of oral motor exercise. This speech therapist is working on getting those nerves to fire by doing some massage on her cheeks, and you can hear the mom in her very southern accent talking about how they want to see her learn to swallow, they want to see her so she's drooling less, and they would like, the mom says, and I like to hear her say mama. And so it's not maybe the most commonly thought of therapy is to think of this speech pathologist kind of working on her face, but I thought this was a good example of one type of CP intervention.